All right, so now what we're going to do is get into the examination. So again, the first thing whenever you do an examination is you start with the history, right, the subjective complaints. You're going to go through the whole process, the old cards. How did it happen? Where's the pain? Always important is the mechanism of injury. You know, what happened? Are there any other signs and symptoms? In this case, what are the types of signs and symptoms that you're going to specifically be looking for or asking about when we're talking about the neck? Well, range of motion is an objective thing. We're talking about signs and symptoms, unless you're saying, you know, do you have any stiffness of your neck? But if you remember before, what was the things, if you were only going to ask two questions, what would the two things be? You know, is it an acute injury or chronic? And then what's the other thing? Does it radiate? Okay, so obviously we're talking about the neck. That's a critical question you want to know. Is there any radiating pain? That's going to tell you that it's either arteries, veins, or nerves are affected that are going down into the extremity. Okay, if it's just inert tissue, joints, facets, cartilage, ligaments, it's going to be just localized to the neck. If it's radiating down, then you're going to know that it's going to be certain types of tissues. And then standard things, you know, what makes it better, what makes it worse. And then sleeping position, I guess that's not up on here, but it's talking about in the notes. And you want to know if somebody, does they have pain when they wake up in the morning? So maybe they're slept in a bad position, or of course, you know, people are traveling, they say, well, I slept in a different bed, had a different pillow, I woke up with pain in the neck. That's going to lead you to believe that it may be related to their sleeping position, versus somebody said, well, yeah, it happens later in the day after I've been working on the computer, so that's a different position that can aggravate. So then observation, we're looking at a bunch of different things. Now, when we talk about antalgia, typically the one thing they talk about for antalgia is like if somebody is, you know, bent over like this, and they're talking about it usually with the lower back. But antalgia can be any type of like pain avoidance positioning or behavior. You know, somebody, we're talking about with the neck, you know, if they're, I had a patient one time, a young girl that had torticollis. So I came into the waiting room and she's there like this. I mean, her ear's on her shoulder. And she said, well, my neck just went like that. So I mean, that's another type of antalgia or you know, postural variation. Antalgia can also be guarded movements. So if somebody is, you know, they ask you to turn your head to the right and they go like this, you know, that's another type of antalgic position or pain avoidance or restrict guarded movements, things like that. So you're just looking at either their static position or how they're moving or lack of movement. You know, if somebody's coming in like this or they get up like this, you know, just observing for things like that. And that's where you can talk about, like, even if you have a window in your office and you see the patient coming in out of their car, you know, it takes them 5 minutes to get up out of the seat. You know something's going on. And then you observe the neck musculature as far as, again, if there's spasm pulling to one side or something like that. And then lordosis or straightening, that's kind of related to posture. But the normal curve in the cervical spine is to have lordosis, so the ear should be centered over the shoulder, or you can see something like this. Or it's better to be visualized on an X-ray where you see straightening of the cervical spine, but sometimes you can notice that visually. Then you're looking for the level of the shoulders, see if the shoulders are rounded forward like this. Looking for deformity, edema, ecchymosis, circulatory. If you're looking at the hands and fingers, again, you're looking for discoloration, blue, white, red. And then posture.
What's ecchymosis?
It's basically discoloration, bruising, like black and blue. I guess I don't have a slide in there on posture, but there's a list of the posturally. Basically what you're going to do is look probably from the front, from the back, and from one side or the other, or both. And then if you draw a plumb line down, it should start going through the external auditory meatus, and that should go through the middle of the neck, anterior part of the shoulder, and then all the way down the list here. Bodies of the lumbar vertebra. Okay, so then you're looking for if the head's carried forward like that, if they have hyperlordosis, all those different types of things. And then as far as front to back, you're looking for, the ears level like this, shoulders, iliac crest, everything down, all the way down. And then on range of motion, okay, that's on another slide. So we talked before about basically, does anybody remember what's the difference between closed pack and open pack or loose pack? Well, in a general sense. Basically, when you're talking about closed pack, you're talking about the position of the joint where it's maximally in contact on the joint surfaces, the ligaments are the tightest. So for in the neck, it's going to be, loose pack is going to be somewhere between flexion and extension. So basically, kind of in a neutral position. And then, it's in the notes. So then the closed pack position is going to be an extension. Okay? So we talked about before, when you go into extension, what part of the vertebral motor unit is going to be compressed? The anterior part or the posterior part? Posterior part, which is the facets. So when you extend the spine and you get some pain and irritation in the neck, what types of structures do you think are going to be more likely to be involved? Facets, right? And then if you flex forward and they get radiating pain down the arm, what types of things would be involved with that?
Yeah. Was it nerve or disc?
The nerve, the discs get compressed when you bend forward, and if it's going down the arm, then you know that it's affecting the nerve root. So it's kind of both of those. Okay, so yeah, here's the things that they talked about with the posture. So you have a plumb line. And so then this would be a closed pack position, an extension where you can see the facet joints are going to be compressed. Whereas when you flex forward like that, the things on the front part are what's being compressed. So the loose pack is midway between flexion and extension, basically in a neutral position. And the closed pack position is going to be extension. And then capsular pattern, what we're talking about with capsular pattern is that if the joint capsule is affected, which planes of range of motion are going to be affected. And in this case, its side flexion and rotation are equally limited. Whereas if somebody's joint capsule, if the whole thing is inflamed or irritated, then you're going to have a capsular pattern, where if it's something else, if it's a fracture or just a facet joint irritation, then you'll talk about, when we talk about with facet lesions, you have pain just in one direction, rotation in one direction. But if it's the whole joint capsule affected, then you're going to have this pattern. And then we'll go through each of these different things when we talk about other different joints. We get into the shoulder, the knee,